Good morning, everyone, and welcome back to the second day of our Institute of Medicine workshop on pandemic financing. Good morning, everyone. Hope you had a relaxing evening. Welcome to the second day of the IOM workshop. Before we start our second day's discussions, I wanted to refresh your memories about some of our discussion from yesterday. There were a few people who had to leave in between a few sessions. Some couldn't join us for the entire meeting. So I want to do a very quick refresh and also tell you a little bit more about the agenda for today. Before I do that, I want to point out that we have people who are joining in through a webcast or webinar, and there is a recording in place. So because of that, let's make sure anytime we have a question or if you're a panelist, speak up in the microphone a little bit, because there are some people who are saying it's harder to understand just because the voices are soft and it's not coming out as clearly. So please speak up into the microphone if you have a question or if you're on the panel. I don't control that, somebody else does. It is on. Okay, so we started yesterday with an introduction from IOM President Victor Zhao, who told us about the architecture of the Global Health Risk Framework and where the pandemic financing piece fits within the 4 other work streams. He highlighted to us what the timeline for this is and the kind of dissemination activities that have been planned once the Risk Commission's report is out. It has a very wide-reaching impact in terms of informing discussions and deliberations at the G7, the G20, and the chair of the commission, Peter Sands, is with us. So if you have questions about the timeline or the processes therein, feel free to ask Peter about that. Then we had a panel discussion that was moderated by Olga Jonas from the World Bank, which was around international cooperative action on pandemics. We learned from Mexico's experience. I think a few key takeaways that I noted down in my notes were ex-ante planning, ex-ante mapping of financing options, ex-ante mapping of legal and other process measures that you can take when something gets classified as a pandemic or an emergency. And also making sure that there is a good understanding at the highest levels of leadership of what kind of needs arise in the event of a pandemic or an emergency and what processes need to be changed. We also learned something about the velocity of disbursement, and I think the idea being sometimes the money flow, the quantum of money exists, but it doesn't flow as quickly as we want it to, and what kind of measures and steps can be put in place. We heard about the work that the US CDC is doing and also experiences about when does something get classified as an emergency or a health event of international concern, and how that impacts the money flow, how that impacts the sequence of activities that follows from that. There was some discussion in that session on are we focusing a little too much on reserves for response versus creating mechanisms and financing models for preparedness, and where does the balance between the two lie? And several people highlighted that in that first session. Our next session was about learning more what the World Bank, the WHO, and the IMF have in terms of their current emergency funding mechanisms. We learned about the IMF mechanism, we learned about what the WHO is doing, and then from the World Bank about their pandemic facility. We also many of us asked questions about what is the complementarity between them, which one plays a role where exactly, and how do they fit into a larger architecture. There were open questions about the World Bank's PEF, which were posed to us by our colleagues at the World Bank, describing that this is still very much a design that is evolving, and there are opportunities to provide input, and also they want to keep it somewhat more flexible rather than over-designing it, being cognizant of the fact that several new initiatives are now happening which are thinking about this. So there were some open questions, but I think complementarity between the different emergency mechanisms was something that we all talked a good bit about. The next discussion session was on adapting insurance products for pandemic risk, which was led by Panos from the IFC. And there we had a very interesting discussion around risk products and risk financing mechanisms, insurance being one of them, but not the only one, and how can some of these be adapted. There were discussions about parametric insurance, parametric risk. There was also some people who highlighted that a large part of the pandemic risk is already embedded in some ways in life insurance products. It's embedded in microfinance and credit life insurance mechanisms already. So how do we think of that? Some people highlighted that it is a larger externality than is seen in other kinds of insurance mechanisms. So how do we deal with such an externality where the benefits are not necessarily to the payers? So those are questions that were posed, but I think we came out of that session saying we probably need a combination of financial instruments or risk instruments that best fits, and we still have to figure out in which phase, which instrument or which combination of instrument applies the best, and that's the sort of thinking that still needs to be developed a little bit further. Our next discussion was around innovative financing instruments and what can we learn from things that already exist or have been tried and experimented with in the last few years. And we heard about the IFM model in greater detail, a mechanism to upfront money so that you can get more cash flow in a short period of time in return for longer term pledges. And how can that be applied, or if there is a way to adapt that for pandemic use. We learned from Unitate about the airline levy and experiences that have come from it. A mechanism that gives a stable revenue stream, but at the same time, it is important to politically ensure that once a levy or an airline tax is signed, it doesn't get used for other things. It is ring-fenced for what it was originally designed for. And we also heard from many of the discussants that it's not just about getting the money, but it's also about figuring out how to use it. And getting money is one part, but figuring out a new mechanism to use that is an important element which should not be forgotten or neglected. We heard from the Global Fund about their promissory note mechanism and some ideas and discussions around social impact bonds, and is there an applicability of that for pandemic work. The last session yesterday afternoon was on risk modeling and triggers, where again, I think what we learned was pandemics have a unique risk profile. It's hard to quantify the risk. Even though we have a few models, many of them are still working with limited data. So we seem to have consensus on the fact, which I think Gordon appropriately put as, we need an ensemble of models which can all be used together in a collective sense in order to highlight what parts of the uncertainty we know, what parts of the uncertainty still remain uncertain, and those could be used by the financial markets and others who are designing risk financing products somewhat better. It was highlighted multiple times that those models should be simple, because simple, objective, and transparent models are the ones that are going to allow people to internalize what is happening with the risk and how to create instruments for it. Then there was some discussion about the designing the triggers for the financial risk and the risk financing instruments. And we didn't come to a conclusion, but I think Martin presented a framework which was simple and had some elements to hopefully help us get to something which could be a trigger for pandemics. We heard the pros and cons of having the trigger too early versus too late, and there are costs associated with both sides of it, and how do we manage that trade-off appropriately. We didn't come up with an answer, but I think at least we could highlight what the costs and benefits of too early and too late triggers are. Then I think for those of you who could join us for dinner last night, we had World Bank President Jim Kim join us for a short discussion and sharing his insights on why this work is important. It was a very inspirational speech by Jim, which focused on how this work fits within the larger global health security agenda, how this is important to G7 leaders, to G20 leaders, and how this is something that he himself is very passionate about, and his charge to us was that if all of us collectively here cannot come up with thinking which can create better preparedness for the next pandemic, then in some ways we will all be held accountable for it by both world leaders that he is presenting this to, but also our own institutions. So it was quite an inspiring comment and speech by President Kim. And so that was yesterday. Today we want to start with a discussion on when money does become available and is dispersed to a country, how is that managed? The management and administration of funds is not always an easy task, and this morning Peter Sands is going to lead a discussion on that, which I think many of us are looking forward to, because we felt yesterday that yes, we are talking about how to get more money, what kind of instruments, but we are forgetting about what happens to it when it gets into the country. Then we have a discussion which is around crowding in and what considerations do donors have, and also some discussion on how to bring in more private capital for pandemic financing. So that's a discussion that will be moderated by Trish Stroman. And then in the afternoon, we want to get into how to make a stronger investment case for pandemic preparedness. How do we convince ministries of health, finance, heads of state, private sector to invest more in pandemic preparedness? And that's oftentimes a quite difficult case, but how do we go about making that case? And then the last session is about, once again, incentives for preparedness, which will be moderated by Milan Brambhat, and the one before that will be moderated by Minister Eduardo from Mexico. So I want to stop there, and if there are questions about logistics or any other matters, please ask one of our IAM colleagues here, and I look forward to a second good day of discussion. Thank you. So I welcome Peter Sands to lead us to the next discussion.